Concerns are growing about COVID cases as the number of people testing positive in hospitals appears to be ticking up. According to new numbers from the CDC, COVID hospitalizations have increased 12% in the week ending July 22nd compared to the week before. ABC News medical contributor Dr. John Brownstein joins me now to break this all down. Dr. Brownstein, can you put these numbers into perspective? Because the CDC and other health agencies, they're no longer tracking COVID cases. The focus is now on hospitalization trends, which experts say is more meaningful. So what do you make of this increase? And is this people going to the hospital because of COVID or just testing positive while they're there, maybe unrelated?
Well, Diane, I know the last thing that people want to talk about right now is another COVID surge, but let's put this into perspective. That week of July 22nd, we saw about 8,000 weekly hospitalizations. We don't know exactly if it was for COVID or with COVID, but if you look at the peak of Omicron, we are at 150,000 weekly hospitalizations. So we're just at a fraction, and they've been going down. 7 months ago, we were at 44,000 hospitalizations, and deaths are stable. There could be some reporting delays, but overall, the outlook is still good. We have to remember that a big percentage off a small number is still a small number. So while the percentage seems alarming, we really are not returning to this crisis level at the moment. It's an important signal to watch out for, but it's not cause for concern.
What do we know about the subvariants going around at this point and the effectiveness of vaccines? And do we have herd immunity at this point?
Yeah, so it's a good question, Diane. We are looking at this subvariant of Omicron. We've had Omicron since late 2022. It's related to that. It's called XBB. Right now, we have XBB 1.5. It represents about 40% of all new cases. So there's nothing really new here in terms of variants. These variants don't cause more severe disease. The current testing works, current treatment like Paxlovid and vaccines, they all work. Now, with herd immunity, it's a complex issue because it's about immunity, it's about global variants, it's about vaccines. So while we're not necessarily talking about herd immunity, we're of course in a much better place when it comes to COVID, especially with new vaccines and boosters this fall on the horizon.
So what's your advice for people who are high risk and for people who aren't?
Yeah, so we have to remember that it's all about your risk tolerance and your underlying risk factors, your age, your underlying chronic conditions. We have to be vigilant. The things like we always know, washing hands, masking for some people still might be relevant, and making sure that you're up to date on vaccines. We have this new booster that's going to be based on the XBB variant coming out in the fall. Definitely look forward to getting that immunization, boosting up that immunity. And with all these tools we have, we will be prepared for the fall.
All right, Dr. John Brownstein, always great to have your analysis. Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.